So we've all been there wandering around the cough and cold aisle in the grocery store or in your drugstore, kind of wondering what drugs should we take to help with our symptoms. So I just wanted to give a rundown of symptoms and what you can take to help that. So the first symptom is coughing. So the only oral over-the-counter drug that's a cough suppressant is dextromethorphan. And that's signified by DM being at the end of the drug. So Robitussin DM has dextromethorphan in it. Mucinex DM has dextromethorphan in it. And it's not that effective as a cough suppressant, but it really is the only oral over-the-counter drug that is a cough suppressant. Actually reduces the urge to cough. The next complaint is people feel like their chest is full of phlegm and mucus, and they can't get it out, and it can make it annoying when you breathe, and you can have it can make you actually harder to breathe when you're trying to cough some of the stuff out. So guaifenesin will actually thin those secretions and make it easier to cough and cough up some of that phlegm. Again, it's not super effective. It's somewhat effective or not that effective. There's been studies that show that it doesn't really do much for cough and upper respiratory infections, but it really is the only drug over the counter that treats that. And the same can be said for dextromethorphan. There are some studies that show it's not even effective at all, but it is the only drug. So drugs that have guaifenesin in it are Robitussin and Mucinex. So if you just bought Robitussin, it would just be guaifenesin. If you just bought plain Mucinex, it would just be guaifenesin. And if you look on the back, it'll show exactly what is in the product that you're buying. And you can see, okay, it has dextromethorphan, it's a cough suppressant. It has guaifenesin, which is which thins mucus secretions. So the next complaint that you'll get with a cough or a cold or a flu is congestion. So if you have just a cold, most of the cough is actually from postnasal drip, and that's actually pretty treatable. So the way that I usually recommend people treat postnasal drip and nasal congestion and a runny nose is Sudafed. Sudafed's a powerful drug. It's sold behind the counter, and it can actually be very effective in reducing nasal congestion, reducing the runny nose, and the postnasal drip. So I often recommend that. There are some caveats. Some people can't take it. Some people with heart problems can't take it, or psychological disorders. So definitely when you're buying it, ask the pharmacist, I have these issues and these are my drugs that I take. Is there an issue with taking Sudafed? And they can tell you, yes or no. And, it's a little annoying buying the Sudafed. You have to show your ID, you have to sign in a log, but it is very effective. So there's a drug that's sold on the shelf called Sudafed PE. Sudafed PE, or any of the drugs that'll have PE, they have something called phenylephrine, which is a nasal decongestant. It's much, much more inferior to Sudafed or psuedoephedrine. So I would avoid Sudafed PE. It's not worth your money and it's not very effective. Another way that you can treat the nasal decongestion is going with a product like Afrin or neosynephrine. These are effective drugs with a very bad side effect, and that is if you take them around the clock or every 12 hours, and you take them for more than 3 days, you can actually get a rebound congestion. So you could be feeling better with your cold, and the drug will actually make the congestion come back, and you might actually become dependent on the nasal spray to alleviate that. So I usually don't recommend that drug. If the congestion is not treatable and you try that, Don't take it for too many days, or you'll have that. Your sinuses will be addicted to Afrin, and that's not a good look at all. So usually, if I have a cough, I'll do a just cough drops, and that helps me. And the congestion I treat with psuedoephedrine. So I get a lot of questions about Zicam. Does Zicam work? There's not a lot of good evidence that it does work. The evidence that is out there shows that it can reduce the duration of a cough by maybe a day. So it's not going to stop it from happening, which is kind of what it claims or what it alludes to. Similar with vitamin C and echinacea, they might reduce the duration of the cough by a day, but or the duration of the cold by a day, but they're not going to stop it from happening. So if you have a cold and you have a sore throat or you have strep throat, really the only way to treat that is with a numbing agent or a cough drop. Cough drop just helps keeps the area kind of, I guess you could say, lubricated, so you have enough saliva. But something like Cepacol or chloroseptic spray can actually numb the throat, and it'll actually help the throat feel better. You won't really feel anything for a little while, and then it'll come back, and you need to take another one. So it can be a little annoying, but that's really the only thing that'll help the sore throat is the lozenges. So I hope you guys found this video useful. If you did, please like and subscribe. Thanks a lot.